Uso po yan. Uso po ngayon yan, vomiting. Dahil sobrang lamig dito sa amin, marami pong nagbabamit. Vomiting. It is unlikely that we will experience the sound of vomiting in the clinic, and this will therefore be information that we are reliant on the client reporting to us. Vomiting that is loud and explosive is heard in excess condition, particularly when there is heat. The Qi being forcibly propelled upward and out of the body in deficient condition, there is not enough Qi to transform the food and liquid consumed nor to send them downward into the small intestine. The accumulation of food and liquid will eventually force Qi upward, but the sound and the force of the vomiting will not be strong. So yung pagkakaiba po, pag deficient, mahina po yung sound. Pag excess, mas malakas. Definition: vomiting or emesis is the forceful expulsion of the contents of the stomach through the mouth. Vomiting, emesis with sound, and vomitus. Silent vomiting, emesis without sound but with vomitus. Retching, emesis with sound but no vomitus or scanty fluid. Pathomechanism: rebellious stomach Qi forces the stomach content out through the mouth. The stomach is a fu organ, which has an abundance of Qi and blood. It prepares moisture and the slight dryness. It is responsible for receiving, decomposing, rotting, and ripening, and causing the food to descend. There are three pathogenesis for rebellious stomach Qi. Stomach Qi obstruction, or yung may stagnation. Exopathogenic attack, and loss of nourishment in the stomach. So yung mga cause pag yun nga sabi, pag sobrang malamig, sobrang mainit, pwede pong magkaroon ng problema yung ating stomach. Nagkakaroon tayo ng vomiting. Ganun din kung may improper diet or may emotional distress or some food organ dysfunction. May produce phlegm, Qi stagnation, or food stagnation. Any of which can obstruct the stomach Qi. When the stomach Qi is obstructed and descending function becomes impaired, and instead of descending, the stomach Qi rises upward to cause vomiting. Naalala ko kaya pag kumakain po example po dito, bawal may emotional distress ka kasi pwede ka pong magsuka. Invasion of external pathogens into the stomach is another common cause of vomiting. The external pathogens is usually dampness combined with seasonal pathogen or indigestion of spoiled food. External pathogen impair the descending of the stomach Qi, which causes the stomach Qi to rise up, resulting in vomiting. Chronic illness or weak constitution may lead to spleen with stomach Qi deficiency or stomach yield deficiency. When there is a spleen in stomach Qi or stomach yield deficiency, there isn't enough power or nourishment to make the food descend and vomiting result. So ang tanda lang po natin, pag nanghihina po ang Qi ng stomach, yun, ang tendency po pataas yung energy kaya nagbabamit. So kabaliktaran po ito sa spleen, sa spleen naman, pag bumaba, spleen po yung humihina. Yan pag nagtatay. So ayan po yung ating diagram, paano nangyayari yung vomiting. Pwedeng pag may improper diet or emotional distress na apektuhan yung Qi or magkakaroon ng phlegm o ganun din galing sa food, pwede po mag-obstruct sa ating stomach. Then magkakaroon ng rebellious Qi. Then ang gagawin ng stomach ay expel niyo yung content through vomiting. So ganun din kung may external pathogenic factor, may init, lamig, sobrang hangin, papasok po sa ating katawan at pwedeng i-affect si stomach. Magre-rebel siya at through stomach Qi expel content. Ibabamit. Ganun din po kung may chronic illness or weak yung constitution. Halimbawa po may stomach Qi deficiency or may stomach Qi deficiency. So loses nourishment sa stomach Kaya magkakaroon ng rebellious Qi. Then, ang gagawin ng stomach, expel po niya yung content. Kaya, merong vomiting. So, the sound accompanying the vomiting can help one determine the thermal nature of the pathogen or disease and whether it is excessive or deficient. Vomiting sound. Vomiting with deep sound, vomitus, is made up of first of clear fluid followed by food, severe abdominal pain, that is relieved by vomiting, usually occurs after overconsumption of raw or food. So, excess condition po yan. Ang indication po yan ay may cold lump sa stomach. Then, vomiting with loud and forceful sound, turbid vomitus, has acidic taste and foul odor, usually occurs after overconsumption of food. So, excess condition po yan, pwede siyang merong food stagnation. Kung nagbabamit naman po with deep, loud sound or retching without vomiting, intermittent po yung attack of nausea and sighing, usually occurs with emotional stress. Excess condition din po yan ng liver and stomach disharmony. Kung ang vomiting naman po ay comes slowly with a weak sound, usually after a meal and little quality of vomitus. So deficiency po yan ng spleen, stomach, yang deficiency. If the vomiting has a violent with sharp and crisp sound, vomitus is made up first of food, then clear fluid or green mucus, occurs immediately after eating, usually in the wake of febrile disease or overconsumption of hot, spicy food. Deficiency po yan ng stomach yin. There are several Chinese terms referring to nausea and vomiting, expressing varying characteristics of degrees of severity. The Chinese term Yi, Zin means nausea, O means vomiting, accompanied by a sound. Tu means vomiting without sound. Gan O indicates short retching with a low sound. Yu indicates long retching with a loud sound. Before the Ming Dynasty, this term indicated hiccup. The two Chinese terms O and Tu are usually used together to indicate vomiting. So, meron na tayong mga Chinese word. Stomach Qi normally descend. So, pababa po yung stomach Qi, ano? If it is ascend, it may cause nausea and or vomiting. So, pag tumaas, yun. May na yung Qi. So, alam natin i-diagnose basta't may pagsusuka, stomach. Pag pababa, spleen. Thus, nausea and vomiting are by definition due to rebellious stomach Qi ascending. This is not to say, however, that they are always due to a full condition, as nausea and vomiting also may be due to stomach deficiency. So, pwedeng excess condition ng stomach or deficient condition. The pathological mechanism is different in its case. In full condition, the stomach Qi rebels upward actively, whereas in empty condition, it fails to descend. In nausea and vomiting from full condition, stomach Qi rebels upward. So, pataas po ano? In nausea and vomiting from empty condition, stomach Qi fails to descend. So, yung pagkakaiba po nila. Therefore, although nausea and vomiting always involve rebellious stomach Qi, this will be accompanied by various stomach pathologies of full or empty type, such as stomach cold, stomach heat, stomach yin deficiency, and etc. These different pathological mechanisms explain the different action of the 2 points REN 13 and REN 10. The former actively subdues rebellious stomach Qi. Yung REN 13 po ano? So, subdues niya yung stomach Qi. Where yung REN 10 helps stomach Qi to descend. So, yun po yung tulong ng mga points na yan. A mild feeling of nausea is usually due to deficiency of stomach qi, with the stomach qi unable to descend. A strong feeling of nausea and vomiting is due to rebellious stomach qi ascending. This may be associated with stagnation, cold, or heat. Profuse and loud vomiting of food soon after eating indicates a full condition of the stomach. Sobrang yan, yung mga kumakain sa itlyoken, pwede pong makaranas ng ganyan. Sobrang busog. Vomiting of fluids with a low sound sometimes after eating indicates an empty condition of the stomach. Pag mahina yung sound ng iyong pagbabamit, deficiency condition po yung stomach niyo. Vomiting of sour fluids indicate stagnation of liver qi invading the stomach. Tandaan po natin yung sour kasi sa ano yun ng liver, di ba? Food taste ng liver. Vomiting of bitter fluid indicates yung bitter is for the heart, in the liver and gallbladder. Vomiting of thin watery fluids indicates cold in the stomach. Vomiting soon after eating suggests a heat condition, while vomiting some hours after eating suggests a cold or empty condition. Yung ating summary ay nausea and vomiting, mild nausea, stomach qi deficiency. Severe nausea, vomiting, rebellious stomach qi. Vomiting soon after eating, stomach full condition. Vomiting of fluid, stomach empty condition. Vomiting of sour fluids, stagnation, liver qi invading stomach. Vomiting of bitter fluids, heat in the liver and gallbladder. Vomiting of thin, watery fluids, cold in the stomach. Vomiting immediately after eating, heat. Vomiting some hours after eating, cold. So, yan. Maganda pong i-ano na natin. I-screenshot po ninyo para matandaan nyo. Para pag mag-diagnose po kayo, yan, makikita po ninyo ano. Case history. A 44-year-old woman had been suffering from palpitation for 8 years. Palpitation was just a subjective symptom of feeling of her heart thumping in her chest and was not associated with tachycardia. The palpitations were always worse before her period. She complained of nausea and gastric pain, which was experienced just under the sternum, a sticky taste, and feeling of a lump in the throat. She also complained of experiencing a dry mouth occasionally. She occasionally suffered from tinnitus. Her periods were basically normal, coming every 4 weeks, lasting 6 days, and not painful. The only problem associated with the period was premenstrual tension. Her complexion was dull and sallow, without luster, and her eyes were very dull and lackluster to an extreme degree. Her tongue was of a normal color except for a red tip. It had a hard crack, and although it could not be defined as being filled, the coating was not sufficient. Her pulse was fine on the right and floating empty on the left. So, ang diagnosis po, the aggravation of the palpitation before the period together with the nausea, epigastric pain under the sternum, and the feeling of a lump in the throat. So, indicate po yan ang condition of rebellious qi sa penetrating vessel. As these vessels flow through the stomach, connect with the heart. So, nakakonect po siya sa heart, ano? Transverse the chest, then sa dibdib, and goes over the throat. Pagkatapos sa heart, sa dibdib, then sa lalamunan, then on its way to face sa mukha. However, the pulse being fine on the right and dull sallow complexion clearly show a condition of blood deficiency, while the floating empty nature of the pulse on the left side and in the sufficient coating on the tongue show the beginning of yin deficiency. Tatandaan po natin pag no-coating yin deficiency of the liver, kidney, and heart. In this case, therefore, The condition of rebellious qi in the penetrating vessel is secondary to the condition of blood and yin deficiency. Magkasama yung pag-blood at saka nagiging deficient. In other words, the qi of the penetrating vessel rebels upward because there is deficiency of blood and yin. In fact, the penetrating vessel is the sea of blood, and it is therefore easily affected by blood deficiency. So the treatment principle in this case, therefore, syempre kailangan mo nating in-nourish yung kanyang blood and yin of the heart and the liver. Primarily, and to subdue rebellious qi in the penetrating vessel. So secondarily po yun. The heart crack and the very dull appearance of the eyes. So nagsasabi po ito na talagang meron siyang disturbed mind and a strong propensity to emotional problems. So yun po, nakatulong po sana sa atin yung pakikinig sa vomiting para sa mas maayos nating pagsusuri sa ating mga pasyente. Thank you po for your attention.